I chose to do my project on the opportunistic infection herpes simplex. And in the background here, you can see a microscopic view of herpes. What is herpes simplex and where is it endemic? Herpes simplex is a virus, also known as HSV, that is placed into two categories, herpes simplex virus 1 and herpes simplex virus 2. HSV1 is also called oral herpes and is spread through the saliva and most commonly found in or on the mouth and lips. HSV2 is genital herpes and it is spread sexually, but it is now known that HSV1 or HSV2 can be genital herpes, not just one or the other. Herpes simplex is usually found on the skin and the mucous membranes, most commonly the mouth, the genitals, or the rectum, but it can also be found in other areas such as the inner thighs, the eyes, or the fingers. And below here you can see on the left another microscopic view of herpes simplex, and to the right you will see the herpes virus life cycle. What are the symptoms of herpes simplex? Herpes simplex is a virus that can be asymptomatic, mainly because the symptoms don't really show up until your first outbreak, which takes a few weeks after you contract the disease, or the person may simply just believe that it's just a rash that they're used to getting and not pay any attention to it. But some of the symptoms that can occur are flu-like symptoms like fever, headache, muscle aches, and swollen glands, a tingling sensation in the affected area, difficulty urinating, groups of small red bumps that form into fluid-filled blisters, as you can see in the pictures below, and then these blisters eventually begin to rupture, and once they rupture, they become painful. And after they rupture, they dry out very fast and heal very fast without any scarring. When you have a case of oral herpes, it may be a sign that they're yellowish in color rather than red when found in the oral cavity. What diseases does herpes simplex cause? Herpes simplex is in a group of herpes viruses that include the human herpes virus 8, which is a virus that causes Kaposi sarcoma, and the varicella zoster virus, or herpes zoster virus, which causes chickenpox and shingles. Now, when you really think about these three diseases, you don't really associate them with herpes as first, but then when you think about it, thinking of what chickenpox looks like, what shingles looks like, and what the Kaposi sarcoma lesions look like, it does look a little bit like herpes. How is herpes simplex treated? The treatment for herpes simplex does not cure the herpes simplex virus because it's always in your body. It can never be taken out of your body. It's always harbored in there. But it's able to prevent or shorten the duration of an outbreak by taking the medication. The type of medication used for herpes simplex virus is an antiviral, and these drugs are drugs that limit the herpes viral replication and its spread to other cells in the body. These drugs are available in both oral forms and topical ointments, but they are most effective when they're taken by mouth. Three of the most common drugs that are used for herpes simplex are acyclovir, valacyclovir, and famciclovir. And for these drugs to be effective, it is important to take the exact dosage and the exact regimen as prescribed by the physician, because we all know that stopping the medication or not taking the right dosage leads to the medication not being effective unless it's consulted by your physician. And taking these medications can reduce the outbreaks of the herpes simplex virus by up to 70 to 80%. Does herpes simplex affect AIDS patients differently? Yes, it does, and it affects AIDS patients in the following ways. HIV-1 infected patients can have more frequent herpes simplex virus lesions, but their lesions are more extensive because instead of just fluid-filled blisters that keep going away and reappearing, They are deep ulcerations that stay around for a long time due to the low CD4 count. Because these lesions are now ulcers, these patients are not able to get rid of them because their body is already immunocompromised from the AIDS. So, because of this, they're more capable of contracting an infection, which can be fatal because their body is not able to fight off the infection. The HSV, we know it causes sores to rupture and bleed. So, a person with AIDS having contact with a person that has the herpes simplex virus is capable of spreading AIDS to that person because they have an open sore and they might not even know, but that's how they're getting the AIDS if they have herpes or vice versa. So it's very important to know what's going on in your body so you can take the preventative measures to help yourself and save yourself from catching something and saving others. And that is the end of my PowerPoint.